You are tuned into the Dr. Tyna Show with Dr. Tyna Moore. For more, visit drtyna.com. On this episode of the Dr. Tyna Show, we're doing a quick and dirty this week, and I want to talk to you about something I think about a lot, which is my dog's health and how that relates to our health. And I'm going to share with you what I mean through this story. Hey, real quick, I wanted to make sure that I share this with you. I have got a free challenge coming up here in the early part of January. As of the airing of this episode, we should have either just gotten started or will be getting started. It is a free 21-day jumpstart. It's called the Strength and Resilience Challenge, and I want to make sure that you guys join me. It's free. This is for anyone of any age, and what we're going to be covering over 21 days is what are your basic strength goals, because you guys need to know what they are so that you have goals for 2025 and you have points that you want to meet, right? We're much better off when we're goal oriented than if we're just like arbitrarily chasing some idea of things. The next piece of it is going to be that we make sure to teach you the basics of what you need to know about your metabolic health. So this is going to be value packed. I'm going to be sending you guys an email every single day. This is for your friends, your family, obviously yourself, young people, older people. I want to make sure that there's something in there for everyone. So go ahead and head over to drtyna.com/strength and resilience. That's drtyna.com/strength and resilience. The link will be in the show notes. If you're watching on YouTube, the link will be in the description below. Go ahead and click it. Put in your name and email. You'll be on the list for when this starts, or if it's already started by the time this airs, you'll get started right at the beginning. So I want to make sure that everybody has the opportunity to have really tangible strength goals and metabolic health goals for 2025, because I know that many of us have New Year's resolutions, but unfortunately, most of those go by the wayside within the first few weeks of January. So I want to make sure that we do something real and helpful and valuable so that we can move the needle in 2025. I hope you'll join us. drtyna.com/strength and resilience. So these episodes are meant to be short and snappy, so we're not going to take forever on this one, but I want to share this with you and I want you to take it to heart and I want you to really consider what it is that I'm saying, because we're all just fancy mammals and humans just happen to have opposable thumbs, but the same rules apply across the board, and dogs are more, I would say, physiologically similar to humans than, say, cats are. So I take a lot of cues from dogs, and I'm not a veterinarian, so I'm not giving any medical advice to your dog or to you. I'm not your doctor. This is all for educational purposes, but dogs really do have a lot of similarities because we're similar types of mammals. We're both somewhat predatory. We have very interesting, we're predators. Yes, we both are. Any animal that has forward set eyes is a predator. So we have forward set eyes and we have canines. I'm sorry if people don't want to hear it. Dogs, interestingly, have a white sclera around their eyes. The whites of their eyes are similar to ours, and that's why we can communicate so well. And they've done a lot of different, I wouldn't say studies, but there have been hypotheses about this going back on how dogs and humans evolved together because of the ability to hunt. The dogs could run down the prey. The humans were big enough and had the tools and spears and things to, end the prey so they could eat it. And everybody won. The dogs protected the tribe. The tribesmen fed the dogs, and that white around their eyes, it enables them to communicate. And then dogs actually have a little muscle in their eyebrow that they've developed over time, which makes them look so cute. When you see the puppy eyes, it's because it's a way of communicating with us humans, and it is endearing to our hearts. But all that to say, we also have a lot of similarities in how we process carbohydrates and our metabolic health. And if you haven't noticed, dogs' obesity levels, canine obesity levels, if you will, in the United States have skyrocketed right alongside humans. So we have a problem, and rates of type 2 diabetes have also skyrocketed right along with humans. And I want to share this story, and then I'm going to tell you some of the details, and hopefully this will be a quick and educational experience for you. I took my dog in to see the vet. I had a Chihuahua. She was a rescue. She was a little nugget. She was a little football nugget. She was one of those kind of potato-shaped Chihuahuas. Some of them are real lean and some of them are real little nuggets, little nugget-shaped ones. She looked like a tater tot. I called her my little tater tot. Her name was Coco, and she was the best. And she's no longer with us, but that little dog was near and dear to my heart. I took her into the vet, and she took one look at Coco, and she said, "That dog's going to have diabetes if she doesn't already." And I said, "I know." And why did she say that? She said that because Coco was a little tater tot. And when a dog is portly and tube shaped and they've lost their waist and you can't feel their ribs or even see their ribs at all, like you can't even palpate them, or not, I shouldn't say see, but when a dog is lean and fit, there's a shadow of ribs. The dog's headed for diabetes. That's just a well-known fact. There's no judgment. There's no, it's not fat shaming. We just know that dog's headed for diabetes. It's the same with humans. It's the same. So I wanted to share with you today some of the visual and physical exams that they do on dogs, on our canine companions, to determine their rates of obesity and if they are headed towards type 2 diabetes. I'm going to leave out the lab tests, the blood work and all that. I'm just going to go with the basics, and I'm just going to preface it with it's the same for humans. All of these things still apply. When I assess a patient or when I take a look-see at someone, I can quickly tell you the trajectory they're headed on with their metabolic health. And after this episode, hopefully you will be able to as well. And again, no judgment. This is to help you sort of have an understanding of where you're at, right? And maybe those around you that you love. So I know people get really butthurt and really emotional about this stuff, but dogs don't. Dogs don't get emotional. Dogs are just dogs, and they know what's going on with their appetite. They know if they're not getting enough movement, they behave certain ways. They start tearing up things when they're not getting enough exercise and they're not getting enough routine. If you're not consistent with them, they start acting funny. If you keep them up all night when they should be sleeping, they're not great the next day. Like, dogs just know, right? And the reason I got to thinking about this was because my dog, who I love, one of my 3, she's a mutt, and she's got a breed in her that makes her tend more towards being a little bit of a potato shape. And recently I have to pick her up and put her in the truck. And then I have to help her out of the truck because she's got some bad back legs. The reason being is, actually, this is important. If you spay or neuter your dog before the age of 2 years old, their risk of, especially females, their risk of developing ACL injuries is incredibly high. And so there are some organizations in the veterinary community that are starting to reevaluate their stance on this. And some are even saying, like, consider waiting until your animal's 2 years old before you spay or neuter, because you're essentially dropping them into surgical menopause. And we all know what happens. Well, maybe you guys don't, but us in the know do know what happens when you get dropped into surgical menopause. If you're a human and you have your ovaries removed and you're not offered HRT, you're in a world of hurt and trouble, in my opinion. There's a lot of risk that you're being thrust into. And I know a lot of you listening probably have been through that, and it's terrible. And I'm sorry that happened to you, but you should have been offered hormones immediately. We do that to our dogs. And then we wonder why they have so many problems. So my girl, who is potato shaped, she's in menopause. We're kind of the same age, if you will, at this point. And in dog years, she's the same age. And I went to pick her up and put her in the truck, and I couldn't lift her. I could, but man, it was a struggle. I was like, girl, you're getting a little chubby. Like, I can't be lifting you. I have to sometimes carry her up 2 flights of stairs because she has 2 ACL issues, both back legs. And I've rehabbed her and I've treated her with stem cells, and I've actually helped her quite a bit, but she sometimes has to get lifted up the stairs, and I have to pick her up to put her up on things, and I have to pick her up to take her out of things that are high up. So because she doesn't have her legs are quite spindly in comparison to her little potato shaped body, but I was like, man, she's put on some weight. So even 5 pounds is very noticeable in a dog her size. She's probably, I would say 55, 60 pounds overall in general. And she definitely chubs up a little in the winter. We all do. We get a little chubby around here because we lose our walking paths. Everything turns to mud. So we're not nearly as active. We're not outside as much because it's raining all the time. So I did buy her a treadmill. I bought a Doggie treadmill. I'll report back on how that's going once we get it. It's on back order, but all the dogs I decided needed a treadmill. So I bought the dogs a treadmill because I do firmly believe, I've been researching this, that they are going to have a significant length in their life and their quality of life if they actually get in the mileage every day that they need to get, which is miles and miles and miles. Like Dogs should be running miles and miles and miles a day. And these dogs right now are going around the house a couple times a day if we're lucky with the way that the weather is. So she needs to lose a few. So I had to figure out who was feeding her extra because she goes across the property to grandma's house and gets an extra meal, maybe 2, sometimes 2 a day, I think. So I had to tell grandma to stop feeding the dog. And I'm the only one allowed to offer her food so I can control what's going in her mouth. And boom, within 3 days, her waist reappeared. I'm not kidding you. And you know what? Getting her off kibble is key. I feed my dogs Sundays, which is, they sponsor this podcast on occasion, and they are an amazing dog food company. They air dry their food. It's so great. It's the consistency of a dried food, but it's not. It's raw and it's not cooked. And kibble is just such a atrocious thing to feed your animal. It really is. I'm not judging anyone. I fed my dogs kibble forever, but when I got her off kibble and onto Sundays, her knee pain significantly improved and her waist reappeared. This was months ago. And then just recently, I know she was getting kibble at grandma's house. So got her off the kibble, got her off the snacks, got her off all that junk, and just controlling what goes in her mouth, giving her lots of raw food, dehydrated liver, dehydrated heart, some cod liver oil, making her just a really nice, healthy gruel. And that's mostly raw or dehydrated. And her waist reappeared within 3 days. So that's what grains are doing to you. So again, on my cereal rant and how I think cereal is human kibble, this is why. If you're eating a bunch of cereal, you're eating a bunch of ultra refined carbohydrates, even if it's paleo or keto cereal or whatever I just don't buy into any of that nonsense at all. And you're eating refined grains that have been processed at high heats to put it into some little pellet form. Like, why are we eating pellet food? Like, nobody should be eating pellet food. Anyway, I'm not going to go on a rant again. I tend to go on a rant about this because the whole Fruit Loops thing. But anyway, assessing obesity in a dog. Let's talk about it. Physical indicators, rib palpation. Ribs should be easily felt but not visible. And when I said visible before, I corrected myself. I mean, we should be able to see a bit of a shadow where the ribs are, if you will, meaning we know that's where they are. It looks a bit different than the skin, say, in the chest area or in the rear area. There's definitely some bones underneath, if you will. I don't know how to describe this. It's something I can see really well because I'm a chiropractor. But anyway, they should be easily palpable. Difficulty feeling ribs without pressing indicates excess fat. This is an indication of obesity in your dog. Abdominal tuck, that's their waist. The abdomen should slope upward behind the ribs when viewed from the side. So when you look at them from the side, they should have that, they've got that nice barrel chest where their ribs are, and it should come up, and they've got that tuck. That's right there, like right as it joins into their leg, their waist, if you will, right where their hip crease is, there should be a tuck. My dog sometimes gets a big saggy belly there, and that's not a good sign, right? Waistline, there should be a visible narrowing at the waist when viewed from above. So when I look down on my dog, she's standing there, she should have a waist. We should have a waist as well. And about the waist circumference I always talk about. I think, we could do waist to hip ratio. I just think waist circumference period is really a very sensitive marker. If folks have elevated blood pressure, they have a waist circumference that's too high. That would be 35 inches for a female. That's the red flag zone. It should be well below that, in my opinion. Or they have a waist as a male of 40 inches. These are in inches. We have a problem. And if they're not strength training regularly as well, I just pretty much can assume they have metabolic compromise. But I have a free guide called Assess Your Metabolic Health. I'll put it in the show notes. You guys can get it also on my website at drtyna.com, and just click the red button at the top and it'll drop you down to be able to opt in and grab the Assess Your Metabolic Health Guide. It is the international guidelines. I've had this up for years. It's a great tool. Print it off, take it to your doctor. It's the international guidelines for metabolic syndrome. It is not meant to diagnose or treat anything. It's just educational purposes, but I want you to have it so you can print it and take it to your doctor and have a conversation with your doctor about it. And then fat pads. We have fat pads all throughout our body. Excess fat over the back, base of the tail, or around the chest may indicate obesity. In a human, I start to look for wings under here, right where your lats would be. Men, especially when they start to accumulate fat there, sort of around the scapula area, that is an indication actually of heart disease as well, or risk of heart disease, I should say. Concern about that. We'll start to get love handles. We'll get a belly. You know the drill, right? You obviously can take in dog terms, they say weight measurement. Compare the dog's current weight to breed standards or prior healthy weights. Breed standards. Let's talk about that. If you have a small petite dog, the dog should weigh less than if you have a large dog, for instance, right? Same with humans. Like, it's very interesting how much weight somebody can carry around the taller they get. And they think, oh, I'm big boned. I'm tall. I'm big. But I can't tell you how many patients I had who were, really tall dudes and were sitting in extreme metabolic compromise because they did carry the weight well. When they're tall, especially kind of a tall, lanky build, they can hide their fat, if you will. And then we have to look at Asian populations and Eastern Indian populations. Those folks at smaller adipose excess will be more prone to type 2 diabetes and metabolic dysfunction, meaning they have less leeway. They have less leeway of the ability, like Caucasians can pack on more fat and be at lower risk potentially, this is case by case, but I'm talking generalities, than their Asian counterparts, because that's just how it is, more risk there. And different groups of people will have higher risk. So we have to be very careful in making blanket statements about parameters around metabolic health when people really should be going and having their doctor assess them. That's what the guide's for, the Assess Your Metabolic Health Guide. It'll give you exactly what you should talk to your doctor about. Very simple. These are lab tests your doctor will do anytime you go in for a physical exam anyway, so you might have them laying around your house. All right, so assessing risk for future diabetes in a dog. Risk factors identified. Obesity is the strongest modifiable risk factor for diabetes in dogs. Let me repeat that. Obesity is the strongest modifiable risk factor for diabetes in dogs. Age, middle age to older dogs are more at risk for type 2 diabetes. Another factor that they consider for risk is intact male dogs are at lower risk than spayed females. Why is that? Intact male dogs have their testosterone, and spayed females are essentially in menopause. Concurrent conditions. Chronic pancreatitis increases diabetes risk. How do you get chronic pancreatitis? That's fatty pancreas. So dogs get fatty pancreas, humans get fatty pancreas. We also get fatty liver. Those increase the risk for diabetes. Chronic steroid use, obviously for allergies or inflammation. So some humans that I've had in my clinic had gotten tons of cortisone injections, and that put them at higher risk for Cushing's disease and then onward into diabetes. So the diagnostic tools and tests would be blood glucose testing, urinalysis, insulin testing, a lot of the same tests we're going to run on humans. And then preventative measures. This is for obesity and type 2 diabetes risk in a dog. Dietary management. Feed a balanced, well-portioned diet designed for weight management or diabetes prevention. High protein, low carbohydrate diets can improve insulin sensitivity. Regular exercise, daily activity supports healthy weight and glucose metabolism, and then monitoring and maintenance, regular weigh-ins and body composition testing, and then early intervention if weight gain or blood sugar irregularities occur. So that is the information that we need to know about dogs. And I think how it can translate into humans is very similar. Can you palpate your ribs, or do you really have to push in to find them? What is your waist circumference like? Do you have a waist? And do you have a pendulous belly that is interrupting your tuck, if you will? Those are all factors to consider. And obviously, check with your doctor, talk to your health professional. This is not for diagnostic, prevention, treatment, none of that, cure, none of it. I'm just trying to educate you because I think about this a lot with dogs, and I'm always trying to keep my dogs on the leaner side so that they don't run into any downstream issues like joint issues, pancreatitis issues, all different kinds of issues that could be thwarted if I kept them at a very healthy weight and physically fit. Same goes for humans. So I hope this is helpful. If you guys like this episode, let me know. We're going to be doing quick and dirties all year long, and I will try to keep them short and punchy and educational for you. So I'll talk to you later. Thanks so much for being here. Thanks for listening to the Dr. Tyna Show. This is a Wellness Loud production produced by Drake Peterson and mixed by Mike Fry. Theme song is by John the Guild. You can watch the full video version of this podcast inside the Spotify app or on YouTube. As always, you can email the podcast at podcast@drtyna.com. That's DRTYNA. And if you like this episode, please rate, review, and subscribe on your favorite podcast app. You can also find all of my offerings on my website at drtyna.com. For more shows by my team, go to wellnessloud.com. See you next time, and thanks for listening. This podcast is for general informational purposes only. It does not constitute the practices of medicine, nursing, or other professional healthcare services, including the giving of medical advice. I am a doctor, but I am not your doctor. No doctor-patient relationship is formed. The use of this information and the materials linked to this podcast is at the user's own risk. The content on this podcast is intended not to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice from any medical condition they have, and they should seek the assistance of their healthcare professionals for any such conditions.